benefits. In other words, at the primary care level, secondary care level, tertiary care level, we want the diseases of alcoholism and addiction. We want the diseases of depression and anxiety and post-traumatic stress treated at all those levels. You know, so we don't leave cancer to become stage 4, right? We treat it in stage 1. We do our best to screen. And you know, why is it that when we comes to people with mental illness and addiction, we wait till they're at death's door before we ever intervene? We never think of, while someone gets a physical checkup, to do a checkup from the neck up. And if we really debated it and really got to it, we could come up with a way to build a version of Medicare for all, although I'm not entirely for Medicare for all because it's got lots of liabilities, but I get the concept of a national health protection and system where you're rewarded for investment in prevention because of all of the dividends it will pay in healthcare that aren't captured in our current model of health insurance, right? So if we redesigned our healthcare system so as to allow, you know, all these insurers in this area, you know, the Cignas and Optums, Uniteds, Blues, Humanas, Aetnas, if we could really get them to compete on who can keep people healthier, then that is the proper alignment of the for-profit motive, the capitalist system, with, you know, what we need for people and their health. And that is, it's then in their interest to pay for whatever it is that's going to help people live healthier lives with less disability. But of course, all the financial, you know, incentives in our current system are geared towards taking care of people when they're sick and not really acknowledging, you know, that we're trying to keep them healthy. Why aren't we doing this right now? Most everyone back in '63 was, let's go slow on that civil rights thing. We'll get to it. And you know what? That's the same attitude towards mental health today. Oh, we'll get to it. Same attitude towards our environment. Oh, we'll get to it. Same attitude with our democracy. Oh, we'll get around to it. But the urgency of now is that we have to get to it on every level. We don't have the great gifted speakers like Dr. King or the great inspirational figures like Cesar Chavez. We don't have some of these great speakers, but we do have their message. And it's as relevant today as it was back then if applied to these challenges we're facing as a nation. And I say all that to you because you're part of one of those in a very up-close way, and that is treating people with dignity. Because it all starts with treating people with dignity and respect. And in our healthcare system, we must change the paradigm. And CareCentrics is about doing the community supports, wraparound services, you know, independent living, that is really both what we need financially in our healthcare system to reduce the total costs of care, but it's also what we need to treat people in a more dignified way.